Hi, I'm Dr. Karen Becker, and today I want to talk about the dangers of overusing steroids in veterinary medicine. When I talk about steroid therapy, I'm not talking about anabolic steroids like testosterone that you sometimes hear about professional athletes using to make themselves big and strong. I'm talking about catabolic steroids that are, in my opinion, wildly overprescribed by conventional veterinarians. Steroids are incredibly powerful drugs that can have very serious side effects most pet parents aren't aware of. There are two primary types of steroids that are naturally secreted by your pet's adrenal glands. The first are called mineralocorticoids, which are produced in the outside layer of the adrenal glands and secrete the hormone called aldosterone. And aldosterone is used by the body to regulate electrolytes. The second type of naturally occurring steroid produced by the adrenal glands are called glucocorticoids or cortisol. These are very potent hormones that influence your dog or cat's metabolism and their immune system function. Synthetic versions of these glucocorticoids are the drugs that are most overprescribed by veterinarians, either for oral use in pill or tablet form or by injection. There are a number of these drugs available, and they usually end in zone. So prednisone, prednisolone, dexamethasone, betamethasone, all the zones mean steroids. Pets prescribed steroids usually have one of three health-related problems going on, the most common of which is inflammation of any kind, and I'll talk more about this in a minute. The least common reason your pet might end up on glucocorticoids is to treat an emergency, like if your dog is hit by a car and suffers acute brain swelling as a result. The emergency clinic will use steroids to very quickly remove the inflammation that's causing the traumatic brain injury. That's a good thing. In these situations, we're very thankful of the existence of steroids because they literally can save lives. Another very common reason steroids are used in veterinary medicine is to intentionally suppress an animal's immune system when they're dealing with autoimmune disease. Autoimmune disease is also called immune-mediated disease. And this is when a pet's body, their immune system is so confused that they actually attack themselves. And in these situations, steroids are used to actually turn the immune system off and intentionally do so to not only provide relief, but to save the patient's life. The hope is that when we wean these patients off of steroids, that their immune system is reset at the balance state. But hands down, the most common reason for putting a pet on steroids are neither one of these life-threatening situations. In fact, the most common reason veterinarians prescribe steroids, usually prednisone, which vets just call pred, is to manage inflammation responses that are usually not life-threatening. Inflammation is an incredibly common reason that pets visit veterinarians, and we diagnose all types of inflammation with the ending word itis. So any type of medical word that ends in itis means inflammation. So dermatitis means inflammation of the skin. Colitis means inflammation of the colon. Otitis is inflammation of the ear canals. We aren't really taught in veterinary school how to diagnose the root causes of inflammation, which is extra unfortunate because we never really get to the root cause of disease. So most conventional veterinarians prescribe a course of steroids for symptomatic treatment, which means when we see anything red, swollen, or irritated, we were taught to think prescribe steroids. Chronic inflammation or chronic inflammatory conditions are also routinely treated with steroids, and these conditions include IBD or inflammatory bowel disease, allergies and other skin conditions, as well as asthma, and even things like inflamed gums or eyes. Even some types of cancers are actually managed with steroids. Now, on the positive side, steroids are some of the most potent drugs we have to manage inflammation, so they're extremely effective at treating a wide range of symptoms. In fact, I was told in veterinary school 25 plus years ago that nothing should die without the benefits of trying steroids first. And a lot of veterinarians kind of live by this mantra. In fact, the very first veterinarian I ever worked for in Chicago, he kept little packets of steroids and antibiotics, amoxicillin and prednisone on the counter in little manila packets of 20 pills each because he prescribed them so routinely that the techs couldn't keep up with just counting pills, so he just had pre-packaged steroid prescriptions ready to go. The downside of using steroids, of handing steroids out like Tic Tacs and candy in veterinary practice, which is incredibly common, the downside is that they have a very long list of side effects, some of which can over time create a whole lot of health problems that actually clients are not informed about and that they didn't know could even happen when their pets were on steroids. One of the biggest drawbacks to steroids use is that actually over time, even maintenance doses of steroids can turn the immune system off, or it can cause what we say immunosuppression. And when animals have immunosuppression, that means their immune systems, because of steroids, are not functioning 100%. And the consequences of your pet being immunosuppressed are vast. When the immune system isn't 100%, a lot of negative health consequences can occur. Your dog or cat can have a very hard time fighting secondary infections, including being able to manage naturally occurring yeast and bacteria on the body. Other side effects of steroid therapy can be increased thirst and hunger, increased urination, peeing around the house, lethargy, GI problems, including GI ulcers, hair loss. A potbelly can be noticed with chronic long-term steroid use, which oftentimes signals the presence of Cushing's disease brought on by steroid use. Blood clots are common, steroid-induced diabetes and pancreatitis, as well as a lot of other secondary infections, depending on what bug or virus your pet's immune system could have been exposed to. For me, the most significant issue with the overprescribing of steroids is that the underlying condition that the original steroid was prescribed for oftentimes never is identified. We need to remember that inflammation is just a symptom that the body produces when there's a deeper issue that needs to be addressed. When doctors use steroids to only treat the symptom of inflammation without pursuing why the body created the symptom in the first place, we aren't addressing or diagnosing the root cause, which, if left undiagnosed or untreated, usually gets worse over time.